Every single day, thousands of older adults end up in the emergency room from something most people never expect: straining on the toilet. We're talking dangerous blood pressure spikes, dizziness, blackouts, even heart-related emergencies, all triggered by a problem almost nobody talks about openly: constipation after 60. Studies show that 3 out of 4 Americans over the age of 60 use a laxative at least once a week. Yet most are still struggling because they were never taught how the body changes with age. In the next few minutes, you're going to discover 3 simple movements that work with your body's natural anatomy to help things move safely and naturally, without harsh laxatives, painful straining, or endless guessing. Excited? And stay with me until the food section near the end, because one everyday food actually outperformed America's most popular fiber supplement in a clinical study. And you may already have it sitting in your kitchen. But first, we need to understand why fiber alone keeps failing so many adults over 60. Because the real cause of constipation is almost never what people think. Before we continue, if you enjoy practical health tips designed specifically for seniors, make sure to subscribe and like the video. Now here's the truth. Constipation after 60 usually comes down to 3 hidden problems. First is muscle coordination. The pelvic floor muscles responsible for elimination don't just weaken with age, they often stop coordinating properly. Instead of relaxing when you try to go, they tighten, making it feel like you're pushing against a closed door. Second is medication. Blood pressure pills, iron supplements, calcium tablets, pain medications, anxiety medicine, and sleep aids can all slow down the colon dramatically. Adding more fiber on top of a sluggish digestive system often makes the blockage worse, not better. Third is dehydration. After age 60, the body's thirst signals become less reliable, meaning many older adults stay mildly dehydrated all day without realizing it. And fiber without enough water becomes hard and difficult to pass. So today, instead of simply adding more fiber, we're going to focus on relaxing the muscles, improving movement in the bowel, and softening things naturally at the source. And the first fix isn't even an exercise, it's changing the way you sit on the toilet. Most modern toilets place the body in a position that slightly kinks the lower colon, almost like bending a garden hose. The solution is surprisingly simple. Raise your knees slightly higher than your hips using a small footstool or sturdy object about 6 to 9 inches tall. Then lean forward slightly with your elbows resting on your knees, and allow your stomach to stay relaxed instead of tightening it. Most importantly, stop straining. Instead, inhale slowly through your nose, allowing your belly to expand outward like a balloon. Then exhale gently through pursed lips while keeping the belly soft and relaxed. This breathing method helps open the pelvic floor naturally instead of forcing it. Take 5 slow breaths. If nothing happens after a few minutes, stand up and walk around rather than pushing harder. That relaxed pelvic floor is the foundation for everything else. Next comes one of the most effective techniques many people have never heard of: the I love you abdominal massage. This method has even been studied in hospitals and nursing homes where many older adults experienced regular bowel movements again within days. Here's why it works. Your large intestine follows a specific pathway through your abdomen, up the right side, across the top, and down the left side. By gently tracing that path with your hands, you physically encourage movement through the colon. Lie on your back with your knees bent and your stomach relaxed. Using gentle but firm pressure with your fingertips, start by tracing a straight line up the left side of your abdomen 10 times. Then trace from the lower right side upward and across to the left side 10 times. Finally, trace a full upside-down U shape from the lower right side up, across, and down the left side 10 times. The full routine takes only about 5 minutes. If you notice a firm or uncomfortable spot, pause and gently massage that area in slow circles for about 30 seconds. Most people begin noticing improvement within a week. Another highly effective movement is the morning knee sequence. This exercise helps physically compress the colon while also releasing trapped gas, which is a major cause of discomfort and bloating in many adults over 60. Lie on your back with your knees bent. Bring one knee gently toward your chest and hold it there while taking 3 slow belly breaths, then switch sides. After that, bring one knee across your body toward the opposite side in a gentle twisting motion while keeping your shoulders relaxed. This movement softly rotates the colon and encourages movement through the digestive tract. Repeat on both sides. Doing this every morning before getting out of bed can make a major difference. And one of the simplest habits on this list may actually be the most powerful. Taking a 10-minute walk within 15 minutes after breakfast. When food enters your stomach, your colon naturally becomes more active. Walking immediately afterward amplifies that natural reflex and often stimulates a bowel movement more effectively than many supplements. Now let's talk about the 4 foods and remedies that consistently work best. Number 1 is kiwi fruit. Eating 2 kiwis a day has been shown in clinical research to improve bowel movements better than psyllium fiber supplements while causing less bloating and gas. Kiwis contain both soluble fiber and digestive enzymes that help soften stool naturally. Number 2 is prunes. Just 5 to 7 prunes daily can dramatically improve stool softness and regularity, though it's best to start slowly to avoid gas. Number 3 is warm water first thing in the morning, about 12 ounces within 5 minutes of waking up. This takes advantage of the colon's natural peak activity in the morning. And number 4 is magnesium citrate before bed, usually around 200 to 400 milligrams, which helps gently draw water into the colon overnight. However, anyone with kidney issues should speak with a doctor before using magnesium supplements. Tonight, try just one thing. Spend 5 minutes doing the I love you massage. Tomorrow morning, drink warm water before breakfast and take a short walk after eating. Those 3 small habits alone help many people notice improvement within just a few days. If you found this helpful, leave a comment sharing which tip surprised you most. And if you enjoy straightforward, practical health advice specifically designed for adults over 60, subscribe to the channel because a new video comes out every week. And finally, a quick disclaimer. This video is for educational purposes only and should never replace medical advice. Always talk with your healthcare provider before making changes to your routine, especially if you have other medical conditions or are taking medications.